Well, kids under the age of 5 are one step closer now to getting vaccinated against COVID-19. Today, FDA vaccine advisors voted in favor of expanding emergency use authorization for both Moderna and Pfizer's vaccine for young kids. Wait, Xavier Wary joins us live now with how soon those vaccines could be available. Xavier.
Yeah, Nikhil, if pharmacies, hospitals, or doctors' offices have already begun the pre-ordering process, then some places may have the vaccine as early as Monday or Tuesday of next week, but it should be widely available throughout the next incoming weeks. And the state health department and the parent, they both tell me that they don't believe that the demand for this vaccine will be particularly high.
Every time that there's been a drop in the age group, there have been less numbers of people that are willing to take that vaccine. And that's just what we've seen in Alabama. So the number of children 5 to 11 who have received the vaccine is much less than the children that are 12 to 17, which is then much less than the general population. And of course, our highest rates are generally among our oldest recipients.
If we say a couple of years go by and it becomes effective and no bad, reaction towards it, then maybe. But like for right now, no.
But whether or not the vaccine will be available depends on the CDC signing off on the authorization for the vaccine. Today, both Pfizer and Moderna presented data that showed how effective their shots were for kids under the age of 5. And Pfizer's trials show their vaccine is 80% effective in preventing symptomatic COVID infections. Kids would get 3 shots, and the first 2 shots would be 3 weeks apart, and the third dose would be 2 months later. And each shot is 1/10 of an adult, which is why experts say that third dose is needed. Meanwhile, Moderna's 2-dose vaccine is only about 40 to 50% effective at preventing mild infections. It is 1/4 of the adult dosage, which they say is strong enough to prevent illness. And clinical studies show the most common side effects for both vaccines are pain at the injection site, irritability and crying, loss of appetite, and sleepiness. And if you have any questions or concerns about your child getting the vaccine, you should contact your child's pediatrician to see what is the best route for them to take. Live in Madison County, Xavier Wary, WAAY 31 News.